Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever wondered what Candida vaginitis is all about? Well, it's high time we shine a light on this common female health concern. Candida vaginitis, also known as a yeast infection, is a condition that affects millions of women worldwide every year. It's an important topic that often gets brushed under the carpet, but today we're bringing it to the forefront. Because knowledge is power, and understanding this condition is the first step in managing it. Now that we've got that out of the way, let's delve into the causes. So, what triggers Candida vaginitis? Well, the primary culprit is the Candida fungus, a microorganism that naturally lives in our bodies, primarily in the mouth and intestines, and for women, also in the vagina. Under normal circumstances, this fungus is harmless, coexisting peacefully with other microbes. However, when an imbalance occurs, Candida can overgrow, causing an infection known as Candida vaginitis. Several factors can contribute to this imbalance. The use of antibiotics, for instance, can disturb the natural microbial ecosystem, allowing Candida to thrive. Pregnancy too can create hormonal changes that make the vagina more receptive to the fungus. Conditions like diabetes and immune system disorders can also make one more susceptible, as they can alter the body's ability to regulate the growth of Candida. In short, while the Candida fungus is a natural part of our bodies, certain factors can tip the scales, leading to an infection. Now that we know what causes it, we can look into how it manifests itself. How can you tell if you or someone you know has Candida vaginitis? It's a question that merits careful consideration. Candida vaginitis often presents with a number of common symptoms. Itching in the vaginal area is a frequent telltale sign, as is a burning sensation during urination or intercourse. Many individuals also report experiencing an unusual vaginal discharge, often described as thick, white, and reminiscent of cottage cheese. However, Candida vaginitis isn't always so straightforward. Some people may experience less common symptoms, such as redness, swelling, or soreness of the vulva, and even pain during intercourse. But remember, these symptoms can overlap with other conditions too. It's important to note that not everyone with Candida vaginitis will experience all these symptoms, and some may not show any symptoms at all. Understanding the signs and symptoms is crucial, but remember, only a medical professional can make a definitive diagnosis. Scene script. How is Candida vaginitis diagnosed and treated? Let's delve into that. Diagnosis typically begins with a thorough physical examination by a healthcare professional. They are likely to ask about your medical history and any symptoms you've been experiencing. They may also perform a pelvic exam to inspect the vagina and cervix for signs of infection. But that's not all. Lab tests are often used to confirm a diagnosis. A sample of vaginal discharge may be taken and sent to a lab for testing. The lab then checks this sample under a microscope to detect the presence of the Candida fungus. Sometimes a culture test is performed, where the sample is allowed to grow in a lab to see if Candida or any other harmful microorganisms proliferate. Once diagnosed, the treatment path is usually straightforward. Antifungal medication is the go-to treatment. These can be in the form of creams, ointments, tablets, or suppositories. It's essential to follow the treatment plan as instructed by your healthcare provider, even if symptoms subside before the medication course is finished. This is to ensure that the infection is completely eradicated and to prevent any potential recurrence. In some cases, long-term medication might be needed, especially for those who experience recurrent episodes of Candida vaginitis. This is why it's crucial to maintain regular consultations with your healthcare provider. Treatment is key, but wouldn't it be better to prevent it in the first place? What can you do to prevent Candida vaginitis? Well, there's a lot you can do, and it starts with a few simple steps. First, maintaining good personal hygiene is key. This doesn't just mean regular bathing, but also making sure to wear clean, breathable underwear and avoiding tight-fitting clothing that can create a moist environment conducive to yeast growth. Next, it's important to steer clear of potential irritants. This can include scented soaps or bubble baths, and douching, which can disrupt the natural balance of bacteria in your vagina. Also, make sure to manage health conditions that can increase your risk. Diabetes, for example, can make you more susceptible to yeast infections, so it's crucial to keep your blood sugar levels under control. Taking probiotics can also be beneficial as they help maintain a healthy balance of bacteria in your body. And finally, always consult your healthcare provider if you notice any unusual symptoms. Remember, your health is in your hands. Stay informed, stay healthy. UMCC, your ultimate medical consultant connectors.